Okay, today our viewer question is about antibiotics. They have asked, do you have any advice for treating recurring UTIs without using antibiotics?
Oh my. Okay, might be a bit of a longish answer because it's a fairly complex question. When people say UTI, they're saying urinary tract infection, and and they are common, especially in women who have, by your anatomy, have a short urethra. The little passage from the bladder to the outside on a woman is very short, and it can be not difficult for bacteria to find their way from, especially the vaginal tract, into the bladder. Us guys have a longer urethra, so we're not as prone to these kind of infections. And in a minute, I'll talk about why a woman may have the urinary tract infection, which is the most important thing. What's really going on here? That's a sign that something's not right if a woman is continually having urinary tract infections. And I'll come back to possible causes for it. But before I do, I just want to say that the term UTI is thrown around quite easily and quickly, where often it's not a true urinary tract infection. The symptoms are, especially in a woman, if she got to urinate frequently every hour and sometimes every 20 minutes. That bladder is really irritated and wanting to contract fairly frequently. And often it hurts, burns when the urine is passed, there's burning. And those are classic signs of a urinary tract infection. That's true. But, as I say, all the wheezes is not asthma. All conditions that cause urinary frequency and burning are not necessarily an infection. Other things can irritate the wall of that bladder. And I've had many women, and at that point it's often called interstitial cystitis. In other words, a urine specimen is sent off for culture, nothing grows. And the urologist said, well, it might be a virus, possibly. She may have been taken too long to get to, she collected the urine specimen at home and waited too long to get it to the lab and nothing grew. But it often, puzzles people why there's no growth here. Is it a true urinary tract infection? Where I'm going with this is often, as you've heard me say, it's the food. It's the food. Remember, whatever we eat for dinner, within an hour, it's sloshing around in our bladder, in the urine. And if you go to sleep all night, the urine in the bladder sloshes around. And if there's something in the food that makes its way into the urine, either directly from the food or it stimulates some bacterial process in the colon and some amines or something else winding up in the blood, then in the urine, then the woman may have a chemical irritation of the bladder. No infection, no bacteria, no organism is involved, but it's a chemical irritation. And that's what should be suspected if several of these episodes go by and the cultures are negative. You got to think, what did I have for dinner? And often it can be the garlic in the spaghetti sauce. It might be the garlic oil. It may have a gluten intolerance. It may be the coffee or the herbal tea that you're consuming. It may well be something in your diet. So before we go down the rabbit hole of true urinary tract infections, realize that in many people, especially women, these episodes of burning and frequency aren't an infection at all. It's a chemical cystitis from probably something in their urine. So what do? Cut back to the real simple thing. For 3 days, 5 days, just eat sweet potatoes, steamed greens, maybe some quinoa, fruits, and I guess legumes would be okay. Cut your diet way back. Stop all sauces and spices and coffee and tea and all that stuff. Put a very soothing food mixture through your intestines. Drink lots of water to flush out the bladder, and often that's all that's needed to make one of these episodes subside. So I just want to mention, keep your food in mind if you're prone to these episodes. That said, what if it truly is an infection and the urine is usually cloudy and it's foul smelling? You send it off to the lab, it comes back with a 4+ growth of E. coli or Pseudomonas or some bacteria. What's happening? This is one place where a course of antibiotics I think is prudent, though you can treat them with a couple of things. There is a sugar, D-mannose, and you can get it off Amazon or online or at the natural food store. D-mannose seems to prevent the bacteria from invading the bladder. Cranberry extract, cranberry tablets work in a similar manner, and they prevent the bacteria from sticking to the bladder wall. And when I was at True North and a woman had early signs of a bladder infection, we'd get her on D-mannose and cranberry tablets, and often headed off at the pass and plenty of water to flush out the bladder. So if you're looking for natural therapies without antibiotics, there is a science behind D-mannose, M-A-N-N-O-S-E, and cranberry extract tablets. That said, if you need 3 days of Bactrim or some antibiotic, that's fine. The issue is recurrent UTIs. Why does this keep coming back? Usually, there's a structural issue there. The urine is meant to flow, okay? As long as it's flowing freely from the kidneys down the ureters, through the bladder and out, there should be no infection. Infection shouldn't get a toe hold or a tentacle hold, whatever bacteria used to get a hold of there, a flagella hold. So if a woman keeps getting it, it's usually there's urine stagnating somewhere. And she either has a silent kidney stone and there's urine stagnating upstream of the stone, or she's had a couple of children and the vaginal wall, the front wall of the vagina has been stretched out, and the bladder, which is immediately in front of the vaginal wall, sags into the down into the vaginal vault there, and you get what's called cystocele, and the urine pools there, and when the woman urinates and squeezes, that low hanging area doesn't empty, and so you wind up with a pool of stagnant urine, and that gets infected. Bacteria find their way in up the urethra and into the urine. So if this is the case, you really should get that fixed. There are wonderful specialists who deal with these very problems. They're usually associated with a university hospital. They are called urogynecologists. They are gynecologists with a special interest in the urinary workings in the female anatomy. There are also gynecologic urologists who converge and do the similar thing. Find one of those kind of specialists, get evaluated, and often it's just an outpatient procedure. They can just put in a couple of stitches to tighten things up, and poof, often that's all that's required. So don't put up with this. Find a good gynecologic urologist or urologic gynecologist. Say, why am I keep getting these infections? And they have all sorts of wonderful scans and ways to track down exactly where the problem is, but you don't want to keep putting up with that the rest of your life. The last one is so-called honeymoon cystitis. One reason, especially newly sexually active women can keep getting recurrent infections is during vigorous intercourse. As the penis goes in the vagina, it picks up a coating of mucus that has the woman's own vaginal bacteria in it. And as the penis goes in, comes out and goes back in, the urethra is sitting right on top of the dorsal side of the penis. There's the urethra, and the vaginal mucus gets stripped off and pushed up into the bladder. And so she winds up with her own vaginal bacteria up in the bladder, and the next morning she's peeing frequently and it's uncomfortable, so-called honeymoon cystitis. Occupational hazard of a vigorous sex life, but they say one way you can help is after some particularly energetic interlude of intercourse, before drifting off to sleep, get up and go to the bathroom and pee and flush out any bacteria that may have gotten introduced there. It's probably the best thing you can do. You might want to take a couple of cranberry tablets or D-mannose tablets prophylactically, and they're benign and might also head off any infections that might be brewing there. Okay, I told you it might be a long one, but you asked about recurrent UTIs. Important, complex, but very important subject to understand and look at from all the various ways and devise the appropriate treatment plan so you can get on with your life without having to deal with recurrent UTIs. Hope that helped. Hi, everyone. Dr. Michael Klaper here, announcing our new format for our Q&A with Dr. K. Annie Hagen will be asking me one question that's been sent in by our viewers. So if you want to see if your question is getting answered, do join us for our Q&A with Dr. K right here. Hope to see you then.